I'm pleased to be with you today to speak about one topic that I love very much, to speak about life course vaccination. And so I am geriatrician, and I'm very proud to be geriatrician. And I've been working on vaccine for probably 20 to 30 years, because I think that, as you said, Francesco, I think that vaccine is not only for kids, but also for all adults. So I would like to tell you that in this room, as all over the country and all over the world, we are aging. All of us are aging, and aging is dynamic, complex, and inescapable. And when we are speaking about aging, you have to know that aging starts at conception and finishes more and more at the old age, or very old age, but unfortunately, very often in bad condition. So this kind of Joe Smith is not good for me to have it here. So, so we will continue. So when we are speaking about the aging process, you have to know that there is two very important factors. The first one is individual factors, and the second one is environmental factors. And when we are speaking about individual factors, you have to know and you have to be convinced that only 25% of our genes have a fixed expression all over life. That is to say that in fact 75% of our genes have a modified expression of our life, which means that epigenetics is much more important than genetics. So life environment is very important because we live in a world with a change of biodiversity, with climate changes, with a lot of pollution, with a lot of wars in the world. So the topic of tomorrow morning was very well chosen for this. And I think that we have to think that our environment of life is very, very important. And for this environment and our own activities is changing because education is very, very important. Lifestyle is very fundamental, but also life behavior, mainly nutrition, physical activities, and vaccines. And the goal of all these things for each of us is to try to age well and to have an healthy aging. How to have an healthy aging and what is healthy aging? By the past, healthy aging was to be free of disease. But now, in 2015, WHO set up a new definition of healthy aging, which is a process of developing and maintaining functional ability that enable well-being in the old age. This definition is a complete change of paradigm, and we have to understand it. So when we are thinking about healthy aging, you can see it is a curve in blue. You have functional abilities all along our life, and then, unfortunately, we have this decrease in abilities and we die. But in fact, what is very important is to know that sometimes the process of functional process all along our life change completely. And we have a bad aging, which lead to disabilities in old age. And the main contributors of this quick aging are chronic diseases, or is chronic disease, loss of immune function, immunosenescence, loss of metabolic function, or undernutrition. Then, between the two curves, you can see that there is one intermediate curve, which is linked to the fact that you could have acute stressors. Among them, we have accidents, acute illnesses, social stress, and you have also the problem to understand that aging is a very heterogeneous individual factors. And we have a few interventions. We can promote healthy aging, among them indeed social engagement, improve nutrition, exercise, and indeed vaccination. I think that there is different things that we have to have in mind also, is in fact that before the COVID pandemics, you have not to forget that we have around 19.3% of deaths which are still linked to communicable disease or infectious disease. So very important. Second point is that we have not to forget that low respiratory tract infections in young adults represent the fourth cause of death in developed countries, which is quite surprising. And then we have, coming back. And then we have this problem, which that the vaccination in old adults is not really right. And vaccine preventable disease occurred in old adults. Why? Because, as you can see on this slide, looking at pneumococcal vaccine, you can see that the rate of vaccination in young children is very much more important than in adults, and in old adults, there is nothing done for that. And what we need to do is to promote adult vaccination at the same level than children vaccination. Is it easy to say, but not easy to do? So, if we are continuing, I'm giving you one example. In 2015, in the States, 14.1 billion of vaccine preventable disease occurred in adults who did not get the vaccine, unvaccinated adults. And that is a pity, because this was a cost which is very, very important. In fact, this absence of vaccination and vaccine preventable disease in 2015 was calculated, the cost was calculated, and the cost was around $9 billion of US dollar in 1 year. So there is a problem of the vaccine, there is a problem of the disease, but there is also the economic problem linked to this kind of adult vaccination disease. So we need to think about immunization as a life course approach. And taking a life course approach means adopting a temporal and societal perspective to help people and, of course, to be integrated into intergenerational determinant of health. That is to say that life course vaccination encompasses actions that are taken appropriately to life transition and together as a whole society. So when we are looking at a few diseases, very important diseases, and all of us probably have atherosclerosis in this room, when we are thinking about this disease, we are speaking about smoking, sedentary, obesity, hypertension, hyperlipidemia, but there is one new factor which emerged, which is the factor of virus. And virus, you can see that because Joe Smith is always here. I'm very sorry for him. Why? He is appearing now. And in fact, we know that now more and more that a lot of infectious disease, influenza, herpes, hepatitis, HPV, HIV, SARS-CoV, provoked atherosclerosis and increased atherosclerosis. And we can prevent, and I will show you later, this kind of problem with flu vaccine, for example, but you have also to think that today, a lot of people are working on trying to have a new vaccine, anti-atherosclerosis vaccine, against this kind of, to protect all people and aging. The second point which is important, which is dementia, and we will speak about this topic tomorrow more in details, but we know quite well the 12 risk factors of dementia that are 12 risk factors at midlife. Smoking, sedentary, obesity, hypercholesterolemia, low education, women, hearing loss, atrial fibrillation, all these risk factors exist, but new risk factors were identified, and particularly HSV 1, 3, 5, influenza, pneumococcus, and also SARS-CoV. And all of them are very important to consider because, in fact, they are provoking dementia. And once again, what we have to do is to promote life long vaccination program. So until now, you cannot believe me, and we will discuss it tomorrow or the day after tomorrow. But there is this study, which is a very important study, published in Neurons 2023. This study is very fundamental. It comes from two biogens bound. The first one is a Finn biogen with 300,000 individuals, and the second one is a UK biobound with 500,000 individuals. And they show very clearly that there is a link between encephalitis and dementia, between pneumococcal disease and dementia, flu and dementia, indeed flu and pneumococcal disease and dementia, and even they show at the beginning here that there is a link between influenza pneumonia and also the, vascular dementia, which you cannot escape to have this kind of data, because when you have this kind of data, you show that there is something behind. What is really behind, we don't know, but there is something behind which is just discovered now. So if now we are not speaking about the life course approach, but different age group, as you said before, I think that fetal infections are at the origin of adult diseases, and it is not well known. And you can see that if there is a restriction in the intrauterine growth linked to a lot of germs, among them SARS, flu, SARS-CoV-2 and measles, or something like that, you have a preterm delivery, you have a low birth rate, and after that, it is now demonstrated that you could have linked this kind of problem with diabetes type 2 and cardiovascular disease in adults, which is very important to convince and to go into the idea of Catherine. More than that, if you are looking at measles, in the WHO region in 2018, more than 500,000 children did not get the first shot of measles vaccine. And after that, there was in Europe more than 100,000 infected persons across all age groups, including all adults. When you are looking at pertussis, when there is no vaccine in children, there is no adult booster, this can explain 20% of chronic cold in nursing home residents. So showing the link between adult vaccination and old age vaccination. When you are looking at pneumococcal disease, it is exactly the same. You know that after the introduction of PCV7 or PCV13, you have a decrease in infection, not only in adults, in children, but also in old adults. And the most important benefits are in old adults after the vaccination of children. And then when you are thinking about RSV infection, we have this kind of problem in infant, but also more and more we have this kind of disease in adults with comorbidities. And now the last recommendation of RSV vaccine in adults was proposed by ACIP in July 2023 for all adults over the age over 60. So when you are thinking about another age, which is adolescence, and you could see that in fact human papillomavirus provoked 5% of cancer in adults, and you can see the different location of the different concepts. So another time link between vaccination and new age and old age. When you are looking at the cardiovascular benefit of vaccine, I think that it's quite surprising that cardiologists did not take this amount of data. Firstly, when you are an healthy adult, if you get the vaccination, you have less chance of dying than if you did not get the vaccine. So we can discuss indeed, because it could be the fact that if you get the vaccine, it is because you are thinking about your health and trying to be healthy, etc. But there is something behind. I show you why. When you are taking person with coronary heart disease and people with coronary heart disease who get the vaccine, but it is terminato, so when we have people with coronary heart disease get the vaccine, the rate of death decreases. When we have people with heart failure who get the vaccine, you have also a decrease in death. And recently, there was a very interesting study which was published, and I will not mention it here, but it is only to compensate the time span. There is one study which was fantastic, which was a very large study of 2,500 participants. These participants were split in two groups. And one group they were hospitalized in emergency for coronary problems. And at that time, when they were hospitalized for coronary problem, they get or they did not get the quadrivalent flu vaccine. And it was shown very clearly that immediately after and during 1 year, the people who got the vaccine after hospitalization for coronary heart disease, they were surviving better. So what can you have as clues? More than that. Same thing for heart failure, just said that, but also for stroke. It seems that stroke, but it is a retrospective study, decrease in people who got the vaccine. Another point, very important thing, is a lot of studies were performed in other kind of diseases, and for example, for patients with diabetes. Patients with diabetes have less infection, and they are more at risk of dying. People with COPD, chronic pulmonary disease, or people with chronic failure has exactly the same kind of benefit of vaccine. So it's something that exists and which is very, very important. More than that, pneumococcal vaccine protect against coronary heart disease, herpes zoster vaccine protect against stroke, and hepatitis B protect against developing diabetes. And if I speak about this kind of diabetes, there is one study which shocked me a lot a few years ago, but Catherine will discuss, can discuss and comment about it. It was a study which was published in the US and it's published in Australia, concerning rotavirus vaccine in young adults, in young children below the age of 5. And it seems that this rotavirus vaccine protects against diabetes type 1. And after that, it was discussed, but it is something very important to know and link all young age and all adults. More than that, it was now shown that if you get flu vaccine, there is a decrease of the incidence of dementia in the old age by 30%. We will discuss it later. What is very important to consider, and until now, even if we say that vaccination are recommended in old age, there was no recommendation for vaccination the people in nursing home. Why? We know very well that for the COVID pandemic, 50% of the deaths occurred in nursing home residents. So I think that we have to try to include the vaccination program in nursing home with indeed antibiotic stewardship, indeed with infection control in the nursing home. But I think that it is important also to say about oral allergen. But we have to recommend for this kind of adult in residence, flu, pneumococcal vaccine, indeed currently COVID, but also tetanus and pertussis, herpes zoster, and also the new vaccine which are coming, and particularly RSV. What is important to say also that we need to think about the vaccination of healthcare professionals. There was one study in France by Mrs. Lemaire, Magali Lemaire, who has proven that, in fact, there is this kind of problem between adults. But before going into this week, I would like to say that with the COVID pandemic, we learned quite well that infectious disease provoked a lot of disabilities. But we have not to think that only COVID provoke disabilities, post-infectious disabilities, but flu vaccine, flu disease, pneumococcal disease, and SLE infection. So you have not to think that vaccines are protecting against the disease, but also against the post-infectious consequences, which are disabilities. And in fact, vaccines are very useful. To last, I would like to say that, and I started to say that a study in France proves that there is a link between vaccination in healthcare professionals and the vaccination and the rate of death of residents. But this study is a study of 12,000 nursing homes in the States, including around 80% of all the nursing homes in the States. And they try to know, and to know if the disease in resident, the mortality of resident is linked to the coverage rates of the healthcare professionals. And you can see that, in fact, the number of resident cases in the group of nursing home where the healthcare professionals were well vaccinated, the disease decreased by 29%. The death of the residents in the nursing home where the healthcare professionals were vaccinated decreased by 58%. And the number of case transmission between the healthcare professionals themselves was above 30%. So there is a clear link between the healthcare coverage rate, vaccine coverage rate, and the death and incidence of disease in all adults. And to last, I would like to show you my take-home message, which is, in fact, we need to have this kind of life course vaccination for a better life. We know quite well, and it is now scientifically well proven, that vaccination in pregnancy, during pregnancy, and in children is very important. It is effective. We have precise guidelines. It is well accepted. So no, it seems in most of the country there is no more problem. But in fact, for adults, there is no recommendation. And as I show you, it is part of the healthy aging. And we need absolutely to think about doing this kind of action to promote healthy aging. Another thing which is important is that for adults with chronic diseases, we have a lot of recommendation, very clear recommendation. But in fact, the coverage rate is very low. Why? We have a lot of knowledge on this. And for all adults, there is no consensual recommendation. These recommendations are really not agreed at the European level, because countries are very difficult to share the ideas, and also the companies who sell the vaccine are not the price is not the same. There is no agreement between them. I tried 3 times to have European recommendation, and I never got any answer, positive answer. And then we have no recommendation for nursing home residents, and we need absolutely to promote flu, COVID, pneumococcal vaccine, shingle, and Beta disease vaccine. So the main thing that I have to say to conclude is, whatever the age, what we need is to improve the vaccine coverage rate. So with that, I will thank you for your attention.